Heidi Rehm dedicated her career to standardizing the methods used to understand genes and variants and integrating that knowledge into patient care. Precision Medicine Online managing editor Turner Ray spoke to her about deciphering the human genome and how data sharing has improved that effort.
Over the last 25 years, what have been the biggest advances that have fueled your work?
I think the biggest advances have been really around the launch of next generation sequencing, where we can very easily sequence a person's entire genome. That really allows us to take a genotype first approach to diagnosis, as well as be able to screen broadly for risk for genetic disorders. And I think that's been fundamentally a major shift in how we use and incorporate genetics and genomics into clinical care. But commensurate with that was the recognition that if we can sequence all of that data at once, how can we keep up with the high labor involved in interpreting all of the variation in the genome, which amounts to 3 to 5 million variants, often in a single person's genome? And I think the other major shift was a culture of data sharing and collective effort around interpreting the human genome, through sharing of evidence, through sharing of variant classifications in ClinVar, all different ways that the community has really risen to the occasion, come together to collectively tackle that major challenge. And now I think the next era will be even more scalable ways that we're going to do that.
So, what do you think are your biggest successes and alternatively your biggest challenges in integrating genomics into medical care?
Um, Certainly that part at the end about developing a culture of data sharing to really support interpreting variants for genomic and diagnosis. I certainly think that I played a role in that part of the puzzle, in really trying to get this notion that we can share in a pre-competitive space, um, and do it widely, openly. And then also, as the senior co-chair of the ACMG AMP 2015 standards, that was another major change in how we all thought about variant classification and the rigor and the evidence required for that, and a more systematic approach. And I think that has given more accurate results to patients. And I certainly feel like I contributed to that effort.
And the challenges?
Oh, the challenges, yes. I think the challenges are that we are still unable to interpret much of the variation that we find in patients. We did a study a couple of years ago that showed that a third of all patients who get diagnostic testing because of symptoms related to a rare disease, are getting an uncertain answer, a variant of uncertain significance. And I think that is a challenge that we still have to tackle, and that is the focus. A lot of the focus of my attention right now is how can we, as a collective community, really make a change there, and not continue to have a third of all patients getting diagnostic testing get an uncertain result. So that, to me, is one of the biggest challenges, and tackling that, so that VUSs aren't the bane of our existence, is certainly one of my biggest challenges, and the community's biggest challenges. And then the second piece is really making sure that everyone has access to these tests, because today they don't all. My transition at Mass General Brigham from being a clinical lab director to the chief genomics officer was really about how can I work with patients and the clinicians and the clinics that serve our hospital and our healthcare system to figure out how patients can get these tests.
Right. And as you said, you have been a big proponent of data sharing in genomics for labs, but you've also encouraged regulators and payers to make data sharing part of their quality check for a lab's variant classification process. So, can you give us an idea of how that has evolved, how close you've gotten to creating that ecosystem of data sharing?
A lot of laboratories have have voluntarily shared their data and didn't need, as many of the sticks, shall we say, the carrots were enough to see the benefit of that data sharing. But when labs are challenged with limited resources, which is true of any clinical diagnostic lab, it's not a business that lends itself to major profits because of the challenges in reimbursement. And so when a lab is struggling to make ends meet, to deliver high quality services, sometimes data sharing isn't the top of the list of what they spend their time on. And we did work with insurers to develop the notion that there's benefit to the improvement and the accuracy of genetic results if you share that data, make it transparent, allow it to be compared to other laboratories. And we were able to make that argument, and as a result, get insurance companies to acknowledge that laboratories that submit to ClinVar are going to ultimately give better results to patients, and that they should consider reimbursing only laboratories that take part in that submission to ClinVar as a quality assurance approach. And several of the insurers did pursue that, and it ultimately led to some of the labs that hadn't quite prioritized data sharing to actually do that. So I think that's been a success. Is every insurer enforcing that? Probably not yet, but it's certainly a concept, one that we continue to support on the ClinGen side and maintaining a list of the laboratories that meet those requirements. We go through an annual process every year, and there are insurers and physicians and others that use that as a source of who they want to do business with or reimburse.
Now, shifting a little bit to the funding environment in the life sciences research space, the U.S. government's priorities have certainly shifted recently, and there have been cuts to research funding, and how has that impacted the programs that you're involved in? Are you worried about the future programs, some of them that we just talked about, like ClinGen and ClinVar?
So far, there's been a maintained commitment to ClinGen. That's also true of the ClinVar program at NCBI, the NLM. So we haven't seen the actual commitment change. I think the challenges have been actually getting grants out the door when there's been a freeze on hiring at the NIH institutes that have been decimated in terms of staffing and the capacity to actually turn over grants and get them out the door. That certainly affected my team and many others. So I think there are certain programs right now that the commitment is still there, but actually realizing that commitment is proving hard in the current federal climate of funding, hiring freezes and things like that.
So despite the current challenges, what keeps you optimistic about what you're doing?
I still ultimately believe that the work we do is incredibly important to patients, to healthcare systems, to society, and I'm not ready to give it up yet. So I think that is what keeps me going. As long as I'm doing work that I can see the benefit directly in terms of patients' lives, then I'm going to keep doing it.
Right. So, kind of looking forward in 25 years, what do you think will be the biggest advances in genomics and precision medicine?
What I hope to see is that we have just a continued exponential growth in the amount of sequencing data that we are generating, but commensurate with that growth in that data, that data is stored in structured and harmonized ways that allow us to share it, potentially through federated approaches, because as a global environment for genomics, not every bit of data can be centralized and sent places, but as we work to develop the tools to allow federated access to data where it stays in place, but we can query it, we can get information from it, I think we can create an incredibly powerful environment for learning about genomics from that data, both through genetic data as well as the associated health data that accompanies it, as well as a lot of experimental data that's being generated through scalable assays of variant, to functional effect, right? So I think I anticipate that there will be a huge amount of effort in generating this data, but also thinking innovatively about how we allow everyone to access that data in ways that inform our knowledge base.